I'm an avid outdoorsman, so I spent my whole life outside. No cancer in my family ever. So for me, it was like a shock, you know, that this would happen, that it could happen to me.
It's really surprising to get that diagnosis when you've been so well behaved for so many years. So that the habits that we have when we're young really do affect us later in life.
I got melanoma, and it can happen to anybody. You need a dermatologist to actually look and to be able to check.
The purpose of screening is always to detect a cancer at an early stage when it can be removed with minimal hardship and with a higher likelihood of cure.
A skin screening is nothing to be afraid of. The doctor actually just looks at your skin.
Dermatologists will do the skin screening, and they are expert at being able to look at something on a person's skin and say, not a problem whatsoever, or that needs to be watched a little bit more closely, or even potentially biopsied.
The biggest thing is to treat it and catch it early.
Earlier skin cancers are smaller, they're easier to treat, and more advanced skin cancers require more aggressive surgical care.
So get it done, it doesn't hurt, and it's a lot better than going through what I went through at the end of the day.
I'm around for my kids, so that's what's important to me.
There are really three different kinds of skin cancers and a few much more rare kinds. There's basal cell cancer, squamous cancer of the skin, and melanoma. But most of them are very easily taken care of. I specialize in the treatment of melanoma, which is a more dangerous kind of skin cancer. Melanoma may often arise from a mole and often looks like a mole. It's a darkly pigmented area in the skin. And melanomas can be removed, and certainly are removed as part of their treatment, but they can spread into the body with more likelihood than the other skin cancers. So they often require treatments that involve the treatment of the whole body. The things you need to look for is any area on the skin that kind of persists and may bleed or itch. And that could be any kind of skin cancer. They might be larger, they might be multicolored or black. Any mole that kind of changes, you have to worry could be a mole that's becoming a melanoma. Best thing we can do is detect these at an early stage. They can almost always be cured if they're removed when they're shallow, but if they're deeper, they may tend to get into the vessels and could spread. Particularly fair-skinned people, people with reddish hair, blonde hair, very fair skin, and people have a lot of sun exposure. Tanning is a big increase in the risk of skin cancer. It sort of doubles the chance of getting a melanoma, and if people can avoid tanning, their risk of melanoma is much less. The purpose of screening is always to detect a cancer at an early stage when it can be removed with minimal hardship and with a higher likelihood of cure. The most important avenue to screening, I think, is for people to have awareness of their own bodies, and if you have a changing mole, to bring it to the attention of their doctor or care provider. Probably it's reasonable to have your skin looked at every time you see your doctor for a general exam. The predominant treatment is surgery right in the beginning, and that may be all somebody needs. If it has spread to the lymph nodes, you may need other therapies as well. And we have recently had quite a bit of success with treatments to try to keep melanoma from coming back by stimulating the immune system or by taking medications that act directly against the melanoma. Many skin cancers can be treated and removed in dermatologist's office if they're very small and very shallow. If they're melanomas, they almost always need a repeat excision of the margins to make sure they don't come back. A plastic surgeon can often do an excision that comes together quite nicely. They make certain they've removed the margins. They can do skin grafts if necessary. And in our practice, they can also look at the lymph nodes. At Minnesota Oncology, we have a good group of people who have expertise in treatment of aggressive skin cancer and melanoma. We have an outstanding plastic surgeon, Dr. Economo, who was really one of the first in the Twin Cities to develop the technique of looking at the lymph nodes at the same time the cancer is removed, which has become a very important and necessary part of the staging and initial treatment of melanomas. And we have a number of medical oncologists who have expertise in it. We have been able to treat people with research-based treatments, clinical trials of newer treatments, and so people had access to newer therapies long before they became available in the general community. And also in the Twin Cities, the dermatology community is very sophisticated and very thoughtful in trying to do the best treatment for their patients. We've been very pleased to work with our colleagues in dermatology. Avoid sun exposure if possible. Use of sunscreen and sun protective clothing if you're out in the sun for a prolonged period of time. The most important thing is just to be aware of your skin so that if you find something changing, don't ignore it, but bring it to the attention of your doctor or care provider.
In 2009, I was in to see my dermatologist for a regular mole check, and he noticed something suspicious on my forehead. The next Monday, he called to tell me it was a melanoma, and they had me in surgery that Friday. They removed the entire section of my upper right forehead, as well as the 2 lymph nodes in front of my ear. I grew up in the 80s and 90s, and we all laid in the sun. We all went tanning. My habits in my younger years resurfaced so much later in life. I was 38 years old when I was diagnosed with a melanoma, and I hadn't been laying in the sun or going tanning for years. Don't be afraid to make mole checks and freckle checks a regular part of your regimen. The melanoma that I had didn't look like the melanomas in any of the pictures that you see of abnormal or atypical moles. I thought that it was a pimple and it didn't go away. So the next time I was in, I had said, what's this one up here? And he's like, we should take a look at that one. So it was not what I was expecting. I was really surprised. It's scarier not to get your skin checked because the longer you wait, some of those abnormalities can progress really quickly. So we were lucky, for me, we caught mine really, really early because I had been visiting the dermatologist regularly. My experience at Minnesota Oncology was truly wonderful. Going through this experience, I felt like my oncologist at Minnesota Oncology had the biggest heart. He was the one who cared about me the most. He spent the most time with me. And I can't say enough, I would send anyone here. Being proactive is really, really important. Just not being afraid to ask questions or go in if you notice something suspicious, if you've had a lot of sun exposure, if you have a mole or a spot or a freckle that looks funny to you, better safe than sorry. Go get it checked out.
The most common types that we deal with are melanoma, squamous cell carcinoma, and basal cell carcinoma. Oftentimes basal and squamous cell carcinomas are treated in dermatologist's office. If they get larger or are in cosmetically sensitive areas, then those are skin cancers that we do treat. Melanoma can sometimes be treated in dermatologist's office, but more advanced melanomas are almost always referred then to a surgeon for more further treatment and evaluation. The key is to be looking for change. And so if a mole is changing in size, shape, or color, certainly those are warning signs that should be evaluated without question. Even new moles should be observed carefully for any evidence of asymmetry, border irregularity, or color change. Earlier skin cancers are smaller, they're easier to treat, and more advanced skin cancers require more aggressive surgical care in order to clear them completely and fully evaluate them for evidence of spread. So if you can catch something early, it's a relatively simple thing to eliminate, and the risk for spread is almost zero. If you get screened irregularly, the odds that a skin cancer will advance significantly are significantly decreased. Skin screening is painless. It's reasonable to see your dermatologist to do that. Some primary care physicians will do it, but dermatologists obviously are specialists and know exactly what to look for. It can be done once a year. If you have lots of moles, then it might be more reasonable to go more often than once a year. And your dermatologist would guide you as far as how often you should be seen. More superficial, small skin cancers are very simply treated and oftentimes in a dermatologist's office. But melanoma specifically requires more aggressive care, and that's because melanoma requires wide excision, meaning we have to take a large amount of extra skin from around the actual primary tumor, and beyond that, evaluate potentially lymph nodes for evidence of spread. And those involve more extensive surgery and require a general anesthetic to perform. Plastic surgery consultants and Minnesota Oncology are partners. I am the principal surgeon of plastic surgery consultants. We provide the surgical care of cancer patients. I treat a lot of melanomas, but they also treat melanoma with immunotherapy. What we do complements what Minnesota Oncology does, so we do share a lot of patients. Our practice, though, is a full-service plastic surgery practice. If it is in a cosmetically sensitive area, we have skills and ability to potentially make the scar blend as much as possible. Beyond that, in melanoma surgery, oftentimes because of the large amount of tissue that we have to excise to treat melanoma, we have to do reconstructive procedures to close the wounds. In addition, I'm the only plastic surgeon in the Twin Cities that does sentinel lymph node biopsy for melanoma. So that allows us to do the complete treatment and evaluation of the tumor for evidence of spread and appropriately guide therapy beyond the original surgical procedure. Any sun exposure will potentially increase your risk for later development of melanoma, and beyond that, tanning booths in particular are very, very much associated with later development of melanoma. It's in your own best interest, obviously, to go in and get screened. In your own best health, to go in and have it evaluated. And more often than not, it's going to be benign, but it's better to know that than to not know and potentially miss something that could be life-threatening.
I'm an avid outdoorsman, so I spent my whole life outside. No skin cancer, no cancer in my family ever. So for me, it was like a shock, you know, that this would happen, that it could happen to me. And so I went in for a routine physical and took my shirt off for the physician, and right away from across the room, toned right in on a mole that looked differently, and was concerned about it, and immediately suggested I get to a dermatologist. They cut it out, did a biopsy on it, saying that it was indeed melanoma cancer. And so then the steps just started. We knew that they had to do a deeper cut into it at that point, and then they wanted to do a sentinel node biopsy. And that then came back positive as well. At that point, Dr. Economo engaged Minnesota Oncology, Dr. Thermos, in the conversation. We had a consult, we talked about what needed to be done. The recommendation was to remove my lymph nodes in my left groin. Thankfully, they didn't find any additional tumors in it. So then it was just a matter of healing and talking through what my options were. At Minnesota Oncology, I felt that they were really advocating for me. Dr. Thermos is certainly a good example of that. Dr. Economo as well. They're just incredibly compassionate and always there to say, if you have questions, tonight, call me. You know, they were on my side all the way through and really trying to move things along as fast as they could. And time seems to be such an important thing during this, you know, getting the answers as fast as you can. And I think Dr. Thermos, in his very kind, caring demeanor, when I walked in, all I wanted to know was my PET scan, did they find anything or not? He barely sat down and he said, everything looks good. It's painless. Yes, they're going to look you over hard, but that's what you're there to do, is to make sure that they don't find anything. And it's a lot better than going through what I went through at the end of the day.
I got melanoma, and it can happen to anybody. You need a dermatologist to actually look and to be able to check. I had a dermatologist friend recommend that I start seeing somebody just because I was tanning and had a lot of moles. And I pretty much went every year for a while, but then I had a lot of moles removed. So I was pretty much on an every 6-month schedule. And then in 2011, I got my first melanoma diagnosis. I had to have surgery, I had to have lymph nodes checked because it was deep, and I was very lucky that it had not been moved into my lymph nodes already. So that was one of 4 of my melanoma diagnoses. So. Nobody should be scared. It's just a full body check. The dermatologist goes through, looks at all your moles, make sure nothing looks irregular, and if they do, they will just remove it and biopsy it, and you can find out results within a week. So it's not scary at all, but the biggest thing is to treat it and catch it early. If it's caught early, it's very, very treatable, which I have found out as well. I have 3 out of my 4 what they call stage 0. They removed them. No further surgery was needed after that. I do have 2 kids. I have a 14-year-old and a 10-year-old, so obviously they will have to be screened as well. I have brought my 14-year-old daughter in to get screened because now they're both at a higher risk because I've had melanomas. I stay out of the sun. I wear a lot of sunscreen. I wear sunscreen every morning. I do wear rash guards, which are the SPF 50 clothing. I wear a lot of long sleeves. I wear hats. I never used to wear hats before. And I will wear hats, and I will be sitting under an umbrella. This is very important that melanomas are caught early because they really can be treated and taken care of right away. I'm around for my kids, so that's what's important to me.
There are 3 main types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. And of those 3, melanoma is the most serious. And we treat it the most aggressively of those 3 types as well. The skin screening is really just a very thorough look at all of our skin from head to toe. And dermatologists will do the skin screening, and they are expert at being able to look at something on a person's skin and say, not a problem whatsoever, or that needs to be watched a little bit more closely, or even potentially biopsied. They're able to tell very quickly whether that's something that's concerning or whether it's something that we don't need to worry about at all. How often a person should get screened for skin cancer really depends on a number of factors. their previous sun exposure, which is the biggest reason for developing really any type of skin cancer. It really depends on if they've had a diagnosis of skin cancer in the past. It also depends on somewhat on family history. There are also some medical conditions which would make us be more vigilant about screening for skin cancers. Some people whose immune system isn't working properly, who are immune suppressed, might need to be screening a little bit more frequently as well, once or twice per year. We really work together in a team fashion. I think that works best for patients. In Minnesota Oncology, we have clinical trials running all the time for melanoma in various stages, whether it's in early stage melanoma or whether it's in people with stage 4 melanoma. We have a very, very aggressive clinical trial program, and that really serves patients well to be able to get cutting-edge medication for treatment of their disease. Because melanoma, and all types of skin cancer actually, do require that a person has a fairly big amount of skin taken off to make sure that all that melanoma has been removed, it may require some additional reconstruction. So within Minnesota Oncology, we take a multidisciplinary kind of approach to patient care, and included that on the care team is plastic surgery. And we have our own plastic surgeons that we work with very closely, Dr. Sam Economo and Dr. Valerie Lemaine, who we all work together to get patients to where they need to be with regard to plastic surgery. If you're going to be outside really for any amount of time, particularly during the summer months here in Minnesota, you just need to be using sun protective clothing can be very helpful. Stay out of the direct sun as much as possible and use sunscreen. 5, 6 years ago, we really had almost nothing to treat patients with. And now we have half a dozen treatment options for patients, including immunotherapy, including targeted therapies, all of which have really helped to extend a person's life and improve quality of life for people with melanoma.